Indeed. Well, so misdiagnosis, budget cuts, incredulity, all of these different factors. Here we are today. Fast forward, President Obama comes out with this, what is dubbed the United Assistance.
Operation United Assistance.
He comes out with Operation United Assistance, almost $1 billion, 3,000 military personnel, the building of a land bridge, the deployment of healthcare workers. What is your assessment, Laurie Garrett, of this plan? Is it having an impact already? It's going to take a while to ramp up, but we don't have much time. What's your assessment of the implementation?
Well, the problem is that from the very beginning, the U.S. knew whatever we were committing as a government had to be augmented by very serious commitments from other countries. The U.S. didn't have enough to be able to commit to handle the problem on our own. For one thing, our military is distracted by many other issues at the moment. But also there was this sort of unspoken understanding, if you will, among the big donors that Guinea had been a French colony, so France should be assisting Guinea. Sierra Leone had been a special colonial outpost of the Great Britain, the UK, so the UK should handle that. And Liberia had been populated by former American slaves, and we'd always had a special relationship with Liberia. So the U.S. announcement was really, for the most part, about Liberia. There's some things that we've committed to do that overlap and will affect all three countries, but for the most part, it's Liberia. And so from the very beginning, it was understood, no matter how large the U.S. commitment would be, if the UK didn't step up to the plate for Sierra Leone and France didn't step up to the plate for Guinea, the virus would continue to circulate in the region. Since then, the problem is that the U.S. commitment's up here, the World Bank's up here with money, and then you drop way down the chart before you start seeing the next tier of commitments. On a per capita basis, the grandest commitment made is 461 doctors and nurses from Cuba.
And so what you're saying is the Cubans, relatively speaking, comparatively speaking, are the ones who are going to have the greatest impact on the ground.
I think, no, I'm not saying that. I think at this time, without a doubt, the combination of MSF and U.S. operatives will have a huge impact in Liberia. The Cubans have gone to Sierra Leone, where there's a much more modest background of commitments by other institutions. The real problem is, regardless, nothing's moving fast enough to get us ahead of the virus. We already need at least 3,000 hospital beds, and at the pace of production of new hospital beds and staffing for those beds, we're only up to about 1,500. So we're already halfway behind the virus. And at the rate that the virus is spreading and the difficulty we're having in getting education properly understood and programs implemented for separating the sick from the well so that spread stops, right? The only way to stop it, since we don't have a vaccine, we don't have a drug, we don't have anything, the only way to stop it is to take the sick and remove them from the well and stop that virus from having the chance to spread, right? Well, at this point, things are going so slowly on that front that unless we see a dramatic change in the next 14 days, we will be looking at 200,000 cases by the end of November, 400,000 by Christmas, and well over that by January.
So you think the CDC's prediction of millions, perhaps by January?
1.4 million.
1.4 million.
That's not millions, plural.
You are right. We may not be able to get ahead of that at this point.
I think it's a race, and right now the virus has the lead by a full lap.